Hello friends, today we are going to discuss about electroconvulsive therapy in child and adolescent population. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMHANS, Bangalore. In this video, I'll be discussing about the indications, side effects, and the law governing the electroconvulsive therapy in child and adolescent population. Electroconvulsive therapy. It is one of the oldest biological treatment available to the mankind. It has stood the scrutiny of the scientific community, general population, and also the human rights activists for the past 8 to 9 decades. Although there are controversies, stigma and discrimination surrounding electroconvulsive therapy, but it is one of the most effective treatment available in psychiatry. There was one of the best review done by Ray and Walter in 1998. This review is about half a century of articles published on electroconvulsive therapy in children. This was between 1942 to 1996, whichever publications which looked into the electroconvulsive therapy in child and adolescent population was reviewed. Ray and Walter identified 396 electroconvulsive therapy related to children and adolescent publications were identified. Although there are no RCTs were available, but they gave into a window of opportunity to look into the importance of electroconvulsive therapy in child and adolescent population. This study revealed important information. It reported the improvement rates were 63% in depression, 80% in mania, 42% in schizophrenia, and 80% in catatonia. This is Ray and Walter in 1998, my dear friends. This is not a small study. It is a review across half a century. Recently, there was another important review article published by Dosing and Pagsberg in 2021. The study of the title, Electroconvulsive Therapy in Children and Adolescent, a systematic review of current literature and guidelines. Let's look into this review. Review by Dosing and Pagsberg in 2021. They found 3,350 studies. They removed the duplicate studies and they ended up 2,801 studies. And also screening some of the articles, they came around 212 studies. Finally, they selected 192 studies for the review. If you look at this, 192 articles, 52 were case studies, review articles were 50, retrospective studies were 30, questionnaire studies were 10, case control study 1, prospective study hardly 5, follow-up studies 7, and guidelines 17. This review, which was done in 2021, could not find even a single RCT with regard to electroconvulsive therapy in child and adolescent population. The current evidence for ECT in children and adolescents seems to be very general in nature, low quality of scientific evidence. However, they do give some important information. The reason for this low quality of scientific literature comes from various challenges. The challenges such as doing RCTs in children is highly unethical. At the same time, children means they have been seen with highly vulnerable, hence nobody gives consent for doing research in children. At the same time, electroconvulsive therapy has its own stigma. The research ethics committee will not give permission to do such studies. And the legal arena thinks that ECT is a barbaric treatment. In this background, doing any kind of research with regard to electroconvulsive therapy will be looked upon with a paranoia. In this background, hence, the literature available over a period of 8 to 9 decades is minimal, but at the same time, these are those studies which gives a glimpse of the evidences which are available with regard to ECT in child and adolescent population. If you look at the response rate across the studies and also comparing between Ray Walter study and the current study, let's look into the response rate across the diagnosis. The first one is mood disorder. Number of studies looked here is 23. And Ray and Walter studies said that depression response rate was 63, mania 80%. The present study said that 77 to 100% remission in depression, 75 to 100% in bipolar, and limited for acute mania was reported. If you look into catatonia, the studies from Ray Walter said that 80% improvement in catatonia, whereas the present study reported around 75 to 76%. Schizophrenia, it is around 42% in the Ray Walter study. In the present study, it is 54%. With regard to intellectual disability and the aggression, the studies were minimal. The same studies also looked into the various guidelines. There were 3 guidelines which were compared in this present study. One was NICE guideline, and also the second one was American Academy of Child and Adolescent Psychiatry and American Psychiatric Association. If you look at all these 3 guidelines, there are some general indications. First and the foremost, it says that the ECT is indicated by the NICE guideline if there are the other treatment options has been proven ineffective, and when the condition is considered to be potentially life-threatening, ECT can be used. In mood disorder, it has been recommended, and whereas in schizophrenia and other disorder like intellectual disability and aggression, it has not been recommended. If you look into American Academy of Child and Adolescent Psychiatry, it says that if there is a failure of 2 psychopharmacological agents, then ECT can be indicated. It is indicated in depression, schizophrenia, and catatonia. However, intellectual disability and self-injurious behavior, aggression, it is not indicated. However, they also indicate for neuromalignant syndrome. In American Psychiatric Association, it also says that if the other treatments are ineffective and if you want to control the symptoms early, the ECT in child and adolescent psychiatry has been advocated. It has been advocated in depression, schizophrenia, catatonia, and neuroleptic malignant syndrome. So, my dear friends, these 3 important guidelines which are used across the world, NICE guideline and American Academy of Child and Adolescent Psychiatry guidelines, American Psychiatric Association guidelines, do indicate the use of ECT in child and adolescent psychiatry population. ECT in children, especially in most of the countries, the indication of ECT is almost similar to adult population. And majority of the studies, which may be case reports, series of case reports, and also the physicians, psychiatrist, the expert opinion clearly says that ECT is well tolerated procedure both in adults as well as in child and adolescent population. Despite the community and also the legal arena thinking that ECT is a barbaric treatment having a negative attitude, but study suggests that the acceptability of ECT in child and adolescent population and also in their family members is very high, and it is palatable treatment according to them. Let's look into the side effects of ECT in children. The side effects of electroconvulsive therapy in child and adolescent population is similar to adults, such as headache, nausea, muscular pain, confusion, and transient memory impairment. However, the question arises, we are giving electroconvulsive therapy in children. The brain is growing. That means, does it have a long-standing effect? There are various studies. Recently, there was a study published by Socio et al. In 2018 in Journal of Affective Disorder. He reported that there is no difference between children and adolescent and also with regard to adult with regard to side effects in the long term. There was one study which looked into long-term follow-up study of children and adolescents who received ECT. They followed up to 3.5 years and they found there is no difference between the children who received only ECT or else medication, and compared to other children, they were almost similar. That means ECT did not have any long-term side effects with regard to the brain growth or neurocognitive development. However, one need to remember in children there are two important complications. Although these complications are very rare but can be life-threatening. First and the foremost is prolonged seizure. Another one is tardive seizures. What is this prolonged seizures? American Psychiatric Association clearly reports that prolonged seizures are defined as a seizures which last for more than 180 seconds, that is 3 minutes, and it occurs in 10% of the children, whereas in adult it is 1% when ECT is given. That means, imagine if you are giving ECT for children and adolescent, at least 1 out of 10 will have prolonged seizure. You need to be ready to abort this prolonged seizure by either giving thiopentone, diazepam or lorazepam. However, it's not life-threatening if you are able to predict it and prevent the complication by giving oxygenation, 100% oxygenation during the seizure period. What is the tardive seizures? Seizures that occurred spontaneously after the termination of ECT seizure. This is, you have given ECT and the seizures are occurred. Now the patient is moved to the recovery area. From the recovery area, he goes to his ward. There he may develop seizures. And again, this is called as tardive seizures. This is very difficult to predict, but however, it is a very rare complication. The risk factors which is associated with tardive seizures are if the patient had maybe on medications which can lower the threshold of seizures. It may be chloropromazine, it can be risperidone, or various other antidepressants. Those medicines can lower the threshold of seizures. And also pre-existing neurological injury can push the patient for tardive seizures. But tardive seizures cannot be directly linked to ECT. But however, whoever has predisposing conditions, maybe family history of seizures with neurological insults to the brain and with maybe childbirth injuries are there, especially to the brain, can be pushed to tardive seizures. Now let's understand electroconvulsive therapy indications in child and adolescent population. APA guideline identifies following indications for ECT in children and adolescent: major depression, mania, schizophrenia, bipolar disorder, or catatonia and delirium has been considered. Even the American Psychiatric Association indicates for medical conditions such as neuroleptic malignant syndrome and intractable seizure disorder, ECT is indicated. Let's understand about how electroconvulsive therapy is administered in child and adolescent population. Here, the ECT administration in child and adolescent population is similar to adult. Pre-ECT workup, ECT administration is similar to adult. Invariably, a course of ECT even in children and adolescent is somewhere around 6 to 12 sessions. And it is administered 2 to 3 sessions per week. Early lack of response may not indicate the failed ECT course, especially in children. In adults and in geriatric population, the patient will respond in the early part of ECT. That means within 2 to 3 sessions of ECT, they will show improvement. In children, they may not show improvement even after 6 to 7 sessions. They may show improvement at the 8th or 9th session of ECT. Hence, it is worthwhile trying around maybe 10 to 12 sessions of ECT in patients with schizophrenia and other severe psychiatric disorders. The most common anesthetic agents used in child and adolescent population is either methoxytol or thiopentone. Succinylcholine is used for muscle relaxant so that seizure-induced maybe fractures can be decreased. Patient should be given 100% oxygen before stimulating with electroconvulsive therapy or maybe electrical stimulation. Immediately after the treatment, the patient must be monitored till the patient recovers and goes back to his ward. Although ECT is regarded as effective treatment in acute illness, it does not decrease the likelihood of relapse. That means you have given ECT and the patient, once the ECT is stopped, he may relapse within a period of days to weeks. Hence, it is worthwhile giving prophylactic medication along with ECT, either concomitant or after stopping the ECT. So it is advisable to start antipsychotics in schizophrenia, antidepressants in depression, and mood stabilizers, especially in bipolar disorder, when you start giving ECT. Do not wait for the ECT to be over, because there is a lag period, especially with regard to medications, to kickstart their action. Invariably, it is around 2 to 4 weeks. That means you started the medication along with the ECT. That means they will get the benefit once the ECT is stopped. If you don't start the medication along with ECT, once after stopping, there is high chances of likelihood of relapse. Let's understand ECT with regard to child and adolescent and law. What does the law say? Because of ECT considered to be highly stigmatizing in the society, many of the leaders in the society have considered to bring in regulation to ECT. Unfortunate this is, but however, it is not banned. It is existed. Some of the monitoring mechanisms have put forward. With regard to Mental Health Care Act of 2017 in India, it clearly says that unmodified ECT cannot be used at all. At the same time, the ECT cannot be used as an emergency treatment under Section 94. These are the two important regulations you should remember with regard to general adult ECT, both in adult and also in child and adolescent. Further, ECT in minor is regulated under Section 94 of Mental Health Care Act of 2017. What does it say? ECT cannot be given unless there is a written informed consent from the legal guardians or the nominated representatives or the parents. Along with that, you need to take permission from the Mental Health Review Board for giving ECT in minor. Minor means it has been defined in Mental Health Care Act of 2017, that is below 18 years of age. How to approach the MHRB for permission? In India, before you give ECT in children, you need to approach Mental Health Review Board. How to do that? You need to admit the patient, either inpatient or else even you can give ECT in children on OPD basis. However, this depends upon the professional discretion based upon the patient's severity of illness, self-injurious behavior, suicidal attempt, aggression, violence, and the patient and family members' preference. Once the patient is admitted or decided to give ECT, you need to take consent from the family members, document the reason for giving ECT, do a thorough evaluation, required baseline investigation, and send an application to Mental Health Review Board for requiring ECT along with the family members. The patient's guardian, that is the family members, will approach MHRB requesting for permission for ECT. That means the psychiatrist need not go for MHRB. The family members will approach the MHRB for getting permission for giving ECT. And here you need to attach the patient's summary, your findings, pre-ECT investigation, along with the reason for indication for ECT need to be documented. Along with you need to also attach the family members' consent for ECT. MHRB, after going through all the documents, they can examine the patient, they can examine the record, discuss with the patient's family members, and if they require or they think they need to interview or examine the psychiatrist, he can be called in. After looking into all these things, Mental Health Review Board either will give permission or deny the permission to give electroconvulsive therapy. This Mental Health Review Board may be looking cumbersome, but having Mental Health Review Board before giving ECT acts as one of the kind of regulatory mechanism and also a safeguard for psychiatrists to say that we took adequate precaution, took permission from the Mental Health Review Board, then only we are giving ECT to child and adolescent population. But however, although there are some scientific evidence, they may not be robust, they may not be scientifically evidence with regard to a randomized control trial, but there are some unanswered questions. First one is, what should be the minimum age of the child where ECT can be given safe? Is it 3 years, 7 years, 10 years, 12 years? We do not know the safe age when ECT can be given. This is still the unanswered question. Some of the guidelines do not permit to use ECT below the age of 11 years. Some of the guidelines says that you can give ECT above 13 years. It depends upon the individual country's regulation and guidelines. At this point of time, I do not have any evidence or come across any literature to robustly say that what should be the age from where we can give ECT in child and adolescent population. At the same time, we do not know what is the safer electrical dose and also the placement of electrodes in children and adolescent population. So these are the two unanswered questions at this point of time. Although there are some questions with regard to scientific evidence, with regard to robust randomized control trial, we do not have. But at this point of time, if you ask, majority of the psychiatrists who are providing care in child and adolescent population do acknowledge that ECT is one of the effective treatment and found to be very safe in certain severely ill patient, treatment refractory patient, and also in patients who are catatonic patients. Now let's look into the ECT in children across the globe. That means, what does various other countries talk about? Across the globe, some of the guidelines like Royal Australian and New Zealand College of Psychiatrists clinical practice guidelines says that 2 psychiatrists should opine before starting ECT, and one of the psychiatrists should be child and adolescent psychiatrist before you give ECT. This is one of the mechanism have been placed to protect the child and adolescent by getting indiscriminate ECT. Another important American Academy of Child and Adolescent Psychiatry 2004, 7 and 2013 editions clearly say that at least 2 adequate trial of psychopharmacological agent and biopsychosocial treatment have failed, then only ECT can be given. To conclude, my dear friend, in most countries, indication for ECT in children and adolescents are similar to adults. Electroconvulsive therapy is well-tolerated procedure in both child and adolescent population. It is a life-saving treatment procedure in severe psychiatric illness. Please know your local laws, clinical guidelines before you give ECT to this population. Although this electroconvulsive therapy is highly controversial, but it has stood the scrutiny of the human rights activist, scientist, researcher, and legal arena over a period of 8 to 9 decades. Despite the misperception among the media, patients, families, and even some of the doctors do not endorse ECT. Although I do recommend ECT is one of the safe and beneficial procedure and with a high response rate in severe psychiatric illness, my dear friends. Thank you very much for giving your valuable time. Stay safe.